Howdy, folks. Today I'd like to talk to you about the war on injured workers and more specifically about my story and injured nurses' stories that's not being told across this nation. Actually, it is being told. NPR is telling our stories, and that's what I'm going to share with you tonight is how NPR has told the story about how our nurses are not being taken care of. I was sentenced to 2 years of criminally ordered mental health treatment. As part of my treatment is to use my channel here to get my story told, how I was harmed and injured on the job and then failed by the state of Washington and others in my health care to use basically not want to honor the grand bargain. And so basically I'm going to use this channel to try and educate folks on how I was harmed and how others are being harmed and the solution that we need and that we've been given by our leaders that no one will put on the table. So I'm going to go ahead and let NPR educate you on how we're not taking care of our injured nurses.
Hospitals could be dramatically reducing the rate of injuries incurred by nurses, but an NPR investigation finds protecting staff in this way is rarely a top priority. As we've been reporting this month, tens of thousands of nursing employees get debilitating back and arm injuries every year from lifting and moving patients. NPR's Daniel Zwerdling has the next installment of our investigation.
We're going to tell you now about the case of Terry Cawthorn and Mission Hospital in Asheville, North Carolina. NPR obtained court records and other evidence about Cawthorn and other workers at Mission, and they give a rare glimpse of how some hospital officials have refused to acknowledge that the everyday work nursing employees do, the way they lift and move patients, that work frequently injures them. Cawthorn had been a nurse at Mission Hospital for more than 20 years.
I was one of the hardest working nurses you would ever meet.
And you don't have to take Cawthorn's word for it. Her supervisor testified under oath that Cawthorn was one of the best.
Never missed work. Came in early, stayed late, but loved being a nurse.
On this afternoon, we are talking at Cawthorn's home in a small town outside Asheville. The refrigerator is covered with photos of her family, and they show Terry Cawthorn before the injury. She looked fit, radiant. Today, her arms are sticks. She has dark patches under her eyes. She and her husband say she's lost 33 pounds since she got injured.
The first 3 years, I couldn't even talk to somebody about it. I would just cry. I'd cry and cry and cry.
Have you noticed how Cawthorn sometimes talks slowly? It's because she's in constant pain, and she takes high doses of prescription narcotics. Terry Cawthorn ended up taking legal action against Mission Hospital, and court documents tell the story. It was afternoon on her 45th birthday, 2008. A large patient had just had a cesarean section, and Cawthorn was helping move her from the gurney onto her bed.
And she kind of had one cheek on the bed, one cheek on the stretcher, and we had it tilted and things trying to help her. I'm just going to show you because we are taught this in nursing school.
And to demonstrate, Cawthorn bends her knees, she keeps her back straight, and she extends her arms like railings for the patient to grip.
And the second she grabbed on, almost instantaneously, I felt like hot tar was just going down my spine into my butt.
Cawthorn says by the time she left work, she could barely walk.
I saw the car drive up on top of the hill.
That's Cawthorn's husband. Tucker's a big man.
I went up the hill, and she could not get herself out of the car. So I wedged myself under her legs and her back, and I eased her out of the car as best I could. And I carried her down the sidewalk into the house, laid her down on the floor.
Cawthorn took painkillers and made it back to work the next morning. She reported she was hurt. Then she hurt her back again barely a week later when she lifted another patient. She injured her back a third time a few days after that. And 9 months later, Cawthorn became a patient in her own hospital. She had major back surgery called a lumbar interbody fusion. She shows me the x-ray. There's a metal cage around her spine.
pretty wild to think that that's true to size.
Now, state laws say that when an employee is injured badly enough on the job, their company has to pay their medical bills and workers' compensation. But officials at Mission refused. Court papers showed that the hospital's own medical staff concluded that Cawthorn got hurt moving patients, but the hospital argued, no, she hurt her back partly by lifting a casserole out of her oven. And hospital officials said as a result of Cawthorn's back injury, she was not fit to work.
They actually saved themselves the postage and brought the paper that I was let go.
I want to get the timing right. You are literally lying in the hospital room 2 days after major back surgery.
Right.
Someone from Mission Hospital comes to your room and gives you the paperwork saying, goodbye, your job is finished.
Yeah. I was so emotionally destroyed. Nursing's not just a job. That's who you are.
There's no evidence that Mission's employees get injured more than staff do at other hospitals. But we're focusing on Mission in this story because we got an unusual look inside this one hospital's culture. We obtained court documents and internal hospital emails. We talked to medical staff who treated injured employees. Of course, remember, Mission's not the only hospital with injured nurses. Officials at hospitals across the country have failed to do much about the problem. And industry researchers say there are a few main reasons why. The first is money.
Tonight's top story, a healthcare crisis in the Berkshires.
The North Adams Regional Hospital is shutting down.
It's been a tough couple decades for the hospital industry.
Daniel McChesney is co-founder of an industry research firm called DeciBio. Studies started showing decades ago that hospitals can prevent nursing injuries if they're willing to invest time and money. They have to buy special equipment to move patients, and they have to do intensive training for the staff. But McChesney says most hospital executives are preoccupied with other problems.
Their revenues have been stagnant or dropping, and the costs have been going up.
Talk about hospitals' costs. They have to prevent infections and computerize their records, and that can cost millions of dollars. They need to invest in new technology. Some hospitals are buying up other hospitals to get bigger and maybe better. So James Collins says, no wonder nurses' injuries fall between the cracks. Collins is a research manager at the CDC, the Centers for Disease Control and Prevention. He's studied nurses' injuries. And he says safety directors in hospitals have told him, look, we've tried to convince our bosses. Our hospital needs to prevent nurses from getting hurt lifting patients. But they tell Collins,
they say, when I think I've got the CEO sold that we need to expend the funds for this comprehensive safe patient lifting program, in comes the chief of surgery describing the latest laser to improve his surgical outcomes, and he gets the check, and then we're back in the end of the line trying to get our funds next year.
To protect the nursing staff.
Right.
And some researchers say there's one more reason why protecting nurses is not often a top priority.
Hey, look who's up. It must be Greg.
Did you see Meet the Parents? In this scene, Greg, he's played by Ben Stiller, Greg meets his girlfriend's family and their doctor friends.
You know, Greg's in medicine too, Larry.
Oh, really? Yeah. What field?
Nursing.
That's good. No, really, what field?
Nursing.
Okay, that movie's just a comedy, but Suzanne Gordon says that hospitals and the medical industry have traditionally devalued nurses.
Hospital administrators, too many hospital administrators, view nurses as second-class citizens.
Gordon's been writing books about nursing issues for 30 years.
Historically, hospital administrators viewed nurses as a kind of disposable labor force.
Gordon says it's partly because of gender. 90% of nursing staff is women, and it's partly because of class. Nurses and nursing assistants don't have much institutional clout. So, when hospitals cut costs...
Children's Hospitals and Clinics of Minnesota is laying off nurses.
Nursing employees are some of the first to go, except during cycles when there's a nursing shortage. And that brings us back to Terry Cawthorn and Mission Hospital in North Carolina. Remember, court documents show that Mission's own medical staff concluded that Cawthorn injured her back moving patients. She had surgery with metal plates and screws. But one of the hospital's officials basically told her, "No, we're not responsible for your injury." And the hospital fired her.
I was so mad. I was yelling at her going, "You can't do this to me. What is going on?"
After the break, we'll take you to Mission Hospital and we'll tell you what was going on.
We're going to return to our story about a nurse named Terry Cawthorn and Mission Hospital in Asheville, North Carolina. As NPR's Daniel Zwerdling has been reporting, hospitals across the country haven't done very much to protect their nursing employees from getting hurt. Nurse Terry Cawthorn was injured so badly she had to have a gruesome back surgery. Leaders at Mission Hospital insisted they weren't responsible, and they fired her. Daniel picks up the story.
Our investigation found that officials at Mission Hospital often refused to acknowledge that nurses and other staff kept getting hurt doing their jobs. Just talk to the medical staff who treated them.
My name is Joshua Claren. I'm a physician assistant, and I worked at Mission Hospital.
Joshua Claren worked in the employee health clinic at Mission for 6 years. He left in late 2012. When nurses and nursing assistants got hurt, when any workers at Mission got hurt, they would go to see Claren and the other clinic staff. That's what Terry Cawthorn did.
It's pretty common to see nurses and CNAs who have hurt their back, who have pulled their back with managing patients, moving patients, lifting patients, sliding patients. It's very, very, very common.
Did you personally examine employees at Mission Hospital, nurses and others, who you felt were injured at work, that they probably did deserve workers' compensation, but then the hospital denied it?
Yes, that was commonplace.
Commonplace?
Yes.
NPR has obtained dozens of internal emails from Mission Hospital, and they show that the doctor who ran the employee health clinic kept warning executives for years, "Our hospital is mistreating injured employees." Those emails went to the hospital vice presidents and the general counsel and a member of the board of directors. But hospital officials basically told the doctor, "This is not your concern." We called the doctor. His name is J. Paul Martin. He declined to be interviewed for this story. But there are public court records that scold Mission Hospital for mistreating injured workers.
What is particularly disturbing about this situation is that this is a hospital.
Douglas Berger was a state judge for 10 years. He served on North Carolina's Workers' Compensation Court. Every state has a workers' comp court, so injured employees can appeal if a company refuses to help them. North Carolina's court has ruled over and over again that Mission Hospital refused to help injured nurses and others who got hurt on the job. Just read the cases. In 2002, 2004, 2006, 2011, again in 2012, Berger wrote in one decision that the hospital's refusal to cover an injured employee's medical care was based upon stubborn, unfounded litigiousness. Stubborn, unfounded litigiousness.
They were acting in bad faith.
The court said officials made a conscious attempt to mislead Terry Cawthorn so she wouldn't understand that she deserved workers' compensation. They said that's fraud, and the court ordered Mission to pay penalties to punish them. Berger says he can't read the minds of Mission's executives, but companies that don't support injured workers often do it for a simple reason: money.
The view is for every dollar I prevent going to a worker, that's more dollars for the company. Well, every money I spend on a worker is less money I can spend elsewhere in the hospital.
And Mission's own report showed that the company has been spending millions of dollars to expand its business.
Care Partners Health Services announces this morning it will merge with Mission Health.
Over the past decade, Mission has taken over or merged with 5 other hospitals. It's taken over doctors' practices and other medical firms. Mission's own spokesperson told a national meeting a few years ago, "We are kind of the 500-pound gorilla in the region."
You have a phone call. It's a pre-op.
I went to see the chief executive officer who runs Mission Hospital. His name is Ron Paulus. He's a doctor. To get to his office, you walk into the huge main building, through the lobby, and up to the executive floor. Paulus says, look, when he took over Mission back in 2010, he didn't even know about all those court cases involving injured employees. But he says as soon as he heard, he essentially told his staff, forget the past. We're establishing a new culture here.
Whatever is the truth or not the truth about all this different stuff, staff injuries from the standpoint of first the humanity of that injury. These are family members, part of our team, but also because we want people to be productive and effective. So yes, these are very important.
Paula says to make sure that everybody gets that message, he launched new training programs for the staff. He hired an outside consultant to analyze how has the hospital handled workers' compensation cases since Paulus took over. He says Mission got a glowing report. And he says the hospital has spent what he calls a significant amount of money to buy machines that move and lift patients so nursing employees can save their backs.
When you look at nurses and patients, nurses have the most interaction with patients of any caregiver on the team, and nurses are the most trusted. So when I think about how I look at care delivery within Mission Health, nurses are front and center.
After I met with Paulus, I talked with a handful of nurses and other medical staff who still work with Mission, or who worked there long after he took over. And they said maybe Paulus has changed the message at the top, but we haven't seen much change. And remember that outside report that Paulus commissioned, which he said shows that Mission is doing a great job handling injured employees? Will you give me the copy of this outside independent review?
I don't have a copy of that, and I'll discuss that internally.
The hospital spokesperson emailed me later. They will not give me the report.
That is how the top of the screw is, so it's got...
Back at Terry Cawthorn's house, this nurse who worked at Mission for more than 20 years has better days and worse days. She helps her husband, Tucker, with his bookkeeping. He repairs air conditioners. She's sometimes shaky when she walks, but they say she's lost more than her health. They say the way Mission Hospital treated her broke part of their spirit.
I really thought that I was someone to Mission. And when I got hurt, I meant nothing. I was absolutely nothing to the hospital.
This change has been incredible so far as our lives go. When she was telling her story a while ago and she started with the day she got injured. It still breaks my heart because that's the day that changed our lives.
Meanwhile, Mission reports it's still expanding. The company's opening new clinics in 2 counties, and it's building a new center for doctors and telemedicine. The company CEO says it's all designed to take better care of patients. Daniel Zwerdling, NPR News.
Wow. There you have it, folks. Her story is my story and many other nurses' stories across this country and other injured workers. I'm going to share a little bit with you my personal story, and then I'll leave it from there. But if you stick around, I will try and educate you on what I know about the war on injured workers, and I'll try to do it politely and without any rage and without any anger. I apologize to some. To others, I don't apologize because I need to be enraged and angry because they're not hearing us and they're not representing us. And I'm trying to do it without rage and anger. So thank you for listening. And I hope you stick around and try to learn something from this channel if you want to learn about the war on injured workers and the solutions we need on the table to get it stopped. Thank you.
Active guy who likes to play hard and work hard. But last year, severe back pain stopped him from doing either.
And when I could no longer be effective at work, when I couldn't do anything with my kids, when I couldn't do the things I enjoyed to do, I started to panic.
Chad had a herniated disc in his spine. At the University of Washington Medical Center's Bone and Joint Surgery Center, Chad was treated initially with non-surgical options. This included steroid injections to relieve pain. When these more conservative treatments weren't effective enough for his condition, Dr. Michael Lee suggested a surgical procedure to remove part of the disc.
And I too lived an active lifestyle, being the sole provider to a family of 4, all the while while working as a patient care technician at the University of Washington Medical Center. Our lives were somewhat similar in a lot of ways, especially in the fact that we both have herniated discs, although for some reason mine gets called a strain all throughout the process until it took me a fight for 5 years finding out if I could get it called a herniated disc, which it is. But I want to show that there's differences and that there's how similar our cases are in regards to our MRIs and how we both have different endings as we go through the process and trying to get our backs treated.
So as we go down to his spine, we see that we see his vertebrae here, and we see his discs here become a little bit darker. You can see these discs are darker, which indicates some dehydration, which is really normal for anyone. It's part of the normal aging process. As we scroll through his spine, you can see that here he's got this disc herniation, which is going back into the spinal canal. You can see this is absent at the other levels. This is how the spine is supposed to look at these levels, and you can see he has a pretty prominent disc herniation going back, pushing into the spine at what we call the L5-S1 level.
And here's a comparison of my MRIs as well. We can see that I too have the same problems with the herniated disc down at the L5-S1 level. Creating the same problems for me, but what I'm kind of getting at is that our treatment offices have been totally different throughout the whole process. I told it took 2 years for them to finally tell me that a treatment option would be the injections, but I still have yet to ever get any of the injections. It's just kind of a double standard in the way things go throughout the whole process. I'm told to keep taking my Vicodin, keep trekking on down to work, and your pain will resolve itself, and when it does flare up, just keep taking some more Vicodin. I don't understand what the double standard is there for.
So there you have it. It don't matter who you are. Work comp, I like to say, is an equal opportunity oppressor. It don't matter how great of a worker you are or who you are, it can hurt you. Next, I'd like to talk about a person named Jason Call, one of my local congressional candidates and my local Democrat PCO, who I asked and begged for help from on this issue for injured workers and a federal oversight for our injured workers, and he called me unhinged. And he told others that Darren is unable to work with others. Well, before workers' comp, I worked really well with others and was even accommodated with an employee of the month about 6 months before I was hurt on the job, young Jason Call. And when people are willing to work with me and willing to put our issues on the table, not just be a distraction from the issues that need to be on the table, I work very well with those kind of people when they're not trying to be basically two-faced with the injured workers of America. So for those candidates and congressional candidates to say I don't work well with people, I worked very well with patients from both sides of the aisle for 15 years. For the last 30 years of a working career, construction 15 years before that, but for 15 years of it, I worked very well with people, and for 30 years I worked very well with people. I became in construction the construction foreman. I always worked my way up. So it's baffling to me when I have young people running for Congress, even teaching our schools, going to say I'm unhinged and I'm unable to work with people, when none of the people from the Bernie-crat coalition or the Democrats wanted to put my injured workers' federal human rights issue on the table with our cries for Medicare for all.
University of Washington Medical Center. Employee of the Month 2010. The Employee of the Month award is presented monthly to a UWMC staff member who exemplifies our ARISE values. Darren Fonciao. Hospital Assistant. Resource Team. Fluid Pool. Accountability. Darren can be counted upon to care for acutely ill patients by taking accurate measurements and documenting this data so providers can make decisions about a patient's care. He does not need to be reminded to implement interventions known to prevent harm to patients within his scope of practice. He can be counted upon to take initiative when caught up with his assigned tasks to look around and find things that need to be done. Respect. Darren represents how to show respect to patients and families at UWMC. I have observed him interact with several patients when he has worked on 7NE. One patient was confused and required close monitoring for safety concerns. Darren was very gentle and respectful when caring for this patient and was very mindful of their dignity. His interactions with other UWMC staff are always professional. Innovation, referencing the confused patient with whom Darren worked for at least 3 shifts, he was creative in adjusting his interactions when caring for this patient in a way that created a calm environment. 2 different RNs working with this patient mentioned to me that the patient was so much calmer when Darren came on shift. Service. By the above example, Darren exemplifies the type of service we would like to see provided by all UWMC employees. Several RNs that have worked with Darren and I have observed him in action and would love to clone him. Excellence. Darren does not do just the minimum that is required for safely caring for acutely ill patients at UWMC. He communicates respectfully with other members of the interdisciplinary team, and we are confident in his skills and know he will ask questions or express concerns if he has them. Any patients and family members that interact with Darren will feel well cared for and feel they have had a positive experience at UWMC.
where they cost contain instead of heal you. Ooh, oh, ow. It's the work home blues, baby. And I'm here to watch you cause it can kill you, man. Oh yeah, yeah, yeah. There's a walk home blues, baby. And I'm here to tell you to run away if you can. For the work home blues, baby. Ain't for the faint of heart, man. They say they hope you make it through. Oh, Lordy, if you can. It's the work on blues, man. Oh, woo!